Double external defibrillator, sir.
Ah,
It is the
different
application and
double sequential defibrillator, isn't it? Not
yes, sir.
it is worded double sequential
Sequential
external
external
defibrillator. Okay. Because there's a small difference. But if you say double external
simultaneous
defibrillator, there is it indicates simultaneous defibrillation.
also.
Whereas if you
Yes,
say
sir.
sequential, it is one after another. Right.
Yes, sir.
Okay. Go ahead.
Double sequential external defibrillation is the application and administration of transthoracic electrical currents from two defibrillator devices to a single patient with lethal dysarrhythmia during cardiac arrest, which is known as refractory ventricular fibrillation. Refractory VF is VF that does not convert with three or more single defibrillation attempts. This double sequential defibrillation is based upon setting up theory in which a first transthoracic current lowers the defibrillatory threshold and it increases the success rate of the second current. It requires deliberate pass in between the currents, which is the currents should be applied close together and not at the same time. And it needs two operators. It is indication. It is indicated in refractory ventricular fibrillation, and there is no contraindications as such. Equipment needed: two biphasic defibrillators, two sets of defibrillator pads, and the preparation. Second defibrillator device should be physically close to the first defibrillator pads, and the use of adhesive hands-free pads is needed. Pad placement: the first set of defibrillator pads in the original location, like upper right sternum border, and the second in the apex. And the second pad should be placed immediately medial or lateral to the pad at the right sternal border without touching. And the second pad of the second defibrillatory device is also placed immediately medial or lateral at the apex without touching the first pad. And the technique, it is based upon a setting of theory, wherein two operators give the shock with an intentional delay in between. And a CPR should be given when both defibrillators are charging to 200 joules, and the patient's pulse is checked after 2 minutes with a cycle of compression. Complications: there is a risk of damaging one or both the defibrillatory devices if pads are touching each other. That's all, sir.
Is it the second defibrillator adhesive paddles? Are they applied only on the anterior aspect, just like the first defibrillator paddles, or anterior
Or
and
it can
posterior?
be applied antero-posteriorly also.
Antero-posterior. That is the recommendation, because when you apply it on the right infraclavicular and the apical region, first paddles, and the second paddle also by the side of the same on the anterior aspect of the chest, the current does not go through to the posterior aspect of the heart. So they recommend that it is better placed in the adjacent to the apical placement of the first paddle, the second adhesive. So you should not use the hand paddles where you use normally for your defibrillation, for a single defibrillator. It should be always the adhesive paddles which are placed like in the normal position for a regular single defibrillator technique in the right infraclavicular and the apical region. And the second paddle is advised to be placed, the first one on nearer to the apical one, but not touching it, and the second one directly posterior on the back, exactly in the midline or a little lateral on the left side. And sequentially, you first give a shock through the first one, then time it in such a way with the second operator that immediately after delivering the first current, within a small fraction of a second, you give the second. The idea behind this is that, as she said, the threshold level comes down when you give the first shock, and the second shock will be able to correct the ventricular fibrillation, which has been found to be refractory by giving single shock after a few seconds of delay with the one single defibrillator. But even though this has been tried, it is not in the AHA guidelines 2020. They don't recommend this direct sequential defibrillation for refractory ventricular fibrillation as a must during the AHA guidelines, which is published in 2020. It is not recommended. So again, to make a visual impression of what you have to see in this, I'll just share this slide. So this is the, so this picture you can see, these blue paddles are the adhesive paddles which are placed in the normal infraclavicular region, and this should be a little above here, like the normal apical position. And the second defibrillator, you can see this is the anterior adhesive paddle, and this lighter one shows it has to be placed on the back rather than close to this on the anterior chest wall. So the second defibrillator adhesive paddles are better placed on the anterior one and the posterior aspect, so that the current will travel vertically down through the major part. So double sequential external defibrillator, or DSED, also referred to as dual sequential external defibrillation, involves the provision of a rapid sequential shock via two defibrillators with the defibrillation pads placed in both the planes, that is anterolateral and anteroposterior. So it is recommended that you keep it in both the planes, and the anatomical location will be uh, the left ventricle, posterior structure. So left ventricle is more posterior. It is the right ventricle which is seen in the anterior below the sternum. In the region of the heart is the farthest from the direct line between standard anterior lateral. So if you keep it in the lateral, the left ventricle will be the most posterior. So resulting in the potential for left ventricle to be inadequately defibrillated. This is the concept or the reason why they wanted this direct double sequential defibrillation. Earlier they did it for double external defibrillation. They simultaneously pressed both the defibrillators and produced 200 plus 200, 400 joules. Energy was transmitted to the patient, but that caused more of damage to the skin and other things, and did not succeed in correcting the refractory. So they changed the position of the electrodes and gave a gap, and went in for sequential defibrillation. So you first give 200 joules with the biphasic defibrillator, and by the anterolateral placement, then follow it up within a fraction of a second. Once the first delivery is done, you give it in the anteroposterior direction from the front and back at the same 200 joules. So it was named as double sequential external defibrillation. The first concept was double summation defibrillation, that you simultaneously defibrillate from both the paddles, which was not successful. And so they gave a small gap so that after the first shock, the potential is reduced, and when the second shock is given, the defibrillation was more effective. So this may be exacerbated by conditions such as left ventricular hypertrophy or dilated cardiomyopathy, in which it will be more useful. So when using DSED, the instantaneous electrical wave fronts become altered by the first standard shock and more amenable to successful defibrillation during the second shock. If the first shock the conditioning shock had not occurred by giving these both them together. So drop in impedance was noted for patients during anteroposterior DSCT shock compared to the impedance measured during the previous failed standard anterior lateral defibrillation, suggesting that the anterior posterior shock delivered more energy efficiently than the standard shock. So consider DSCD for refractory VF after 3 failed standard shocks. This is one of the recommendations, that you can't directly go for DSCD. So you first try the standard method of the inferior and apical position and try for the anterolateral shock. After 3 attempts, if the VF is not getting corrected, then you can go for DSAG. And simultaneous defibrillation with two defibrillators carry very low theoretical risk of damaging the, make sure that the two adhesive electrodes don't touch each other, very important. Sometimes they earlier thought that the current will pass from one pad to the other and go back to the machine and damage the machine. So that has not been proved to happen. So therefore ensure sequential shock delivery when using DSEV. So that is all the points that we have to remember for this.